My objective is to take a model that we have been using now for 17 years across borders. It's a very definitive model in that we focus on health as a bridge to peace. We focus on the capacity building, the strengthening of health systems, looking after improvements in health care for each and every individual. Our focus is largely on the disabled, on mothers and children, the disadvantaged among us who need our help. For people in a region in conflict where there are people who not only wouldn't get together, wouldn't talk together, but would never be seen as working together. And yet it is all possible by focusing on common needs using health as that common language. So our meta-level objectives are to promote trust, confidence, cooperation, and relationships between Arabs and Israelis. We want to lead to health to peace education, training, research, and service initiatives, and we can actually address global health issues and build relationships in a needy world. So we had a whole series of meetings on the ground bringing together healthcare professionals, physicians, scientists, nurses, audiologists in Gaza, in Nablus, in Tel Aviv, in Amman, Jerusalem, Haifa. If it got too hot in the region, we went to Cyprus. So our first project was to screen 18,000 newborns, Israeli, Jordanian, and Palestinian, and determine the protocols that we could work on in the region. We did 8,000 newborns across Jordan. We did 8,000 newborns across Israel. In the West Bank, it was more difficult. We had to bring the mothers to deliver at Baqasad Hospital in East Jerusalem, but we established protocols, and then we moved, again, with CETA, the Canadian International Development Agency, that's the homologue to your American USAID. We moved to then promote universal newborn hearing screening in Jordan through a project that started in 2001 and continued and then became national health policy in January 2007. We were there for that beginning. We were also there for the first cochlear implant surgery where we trained together Israeli, Jordanian, and Palestinian surgeons at the University of Tel Aviv and then went forward to the King Hussein Medical Center and did the first 2 cochlear implants with an Israeli and a Jordanian surgeon working together to carry out the cochlear implant surgery, and our Palestinian partner being involved in setting up the cochlear implant functionally and moving on to the rehabilitation. Quite a story of itself. CISPO is about to partner. The agreement is set. It'll be done through something called Solar Ear, and that is the production of affordable solar-powered hearing aids made by the disabled for the disabled in the Middle East. It will have Palestinian, Jordanian, Israeli components, and this will allow us to be able to provide the poor and needy with hearing aids they might not otherwise have. Everything's built on mutuality and respect and cooperative activities. We use a 5-level approach: health system capacity building and health education, engagement of medical professionals via cross-conflict local service associations, research collaborations, student and youth engagement, and that's regional and international through student clubs such as this and academic exchanges. Then the general population engagement, person-to-person or people-to-people initiatives, and finally helping regional partners go forward on their own.
This dialogue to action concept, which ways can we be talking about this in America and Canada? How do you see the easiest way for us to turn this dialogue into action?
We've got some good examples, so I think the core of your question is how do we take it to scale? Like, how do we ramp it up? And I think we certainly at the level of youth and what's just been happening with the social networking, that technology, we can very quickly, powerfully engage at the youth level. I think it's more of a challenge to get people like me with gray beards. We're less likely to be on Twitter, etc. But we need to find ways at the more senior level of engagement. But we've got good stories. How do we get these out and get a broader dialogue going? And I would really encourage youth to take the leadership on this. And it was really youth who have taken the leadership currently in the Middle East, in Egypt, and that as far as saying we've had enough, we don't have a future, and we've got to find a way of moving to a more equal or democratic society. So I think using the technologies, and I think with the key example stories we have, that we could find ways to rapidly move forward. At the core of all this is respect and how we expect and treat each other. And Ziad Abdin, our Palestinian regional director, put it so nicely in a presentation he made in Toronto a number of years back. And he said, within our work with SISBO, we're equals in the collaboration, if not in our current circumstances. And our goal over time is to raise the floor of positive circumstances for everyone within SISBO and within the region. So I think it's that value of respecting that we're coming in with different levels of resources, and but we try to really level the power structure, and we respectfully really treat everyone as equals in this partnership. And I think that core value is just vital in order to attract and sustain this type of work.
What can we take from this and actually implement here on campus? Because from being at York for the past over, I guess, 7 years, I could see cases where people might be afraid to talk with one another and create friendships. And I've seen many cases where this is not the case, where there are very brave and people that are willing to listen to one another. So how do we want to expand it? So that tying to how do we make dialogue into action in our own community? And I guess this is sort of opening it up to other members.
Well, you have a great example in your portfolio of a program from the University of Western Ontario, Sadaka Tzedekah, that's where Jewish and Muslim students have gotten together to make sandwiches for homeless youth and others in need. And that's a beautiful example of a community-based project. Everything doesn't have to focus back on our interest now in the Middle East. This is a model. If we can do this in a region of conflict, then we should be able to do this among our communities. And I think the first thing it takes is a willingness to step forward, leadership, not worrying about, I think the whole thing to do is to do what's right. If you're doing what's right, I don't think you ever have to be afraid or discouraged. I think the stimulus of knowing that there are others around you who are prepared to partner with you and move ahead.
My name's Paulina. I'm from York, and I'm wondering, there's a lot of talk about dialogue between communities and the kind of conversations people have once they come together. But I'm curious about experiences where, the parts that come together are communities in and of themselves, and they're not homogenous. So what kind of conversations go on within the communities that then come together to work together?
Sure. No, I think it's a very important point, and I think each of the communities is really quite diverse. I guess our experience has been that if you actually find a way to get to know the other and to recognize their interests and their commitment to their community, but also to their family, and to learn a little bit more about them as individuals, that's a way of contributing to there being a real substance to the group. So in what we've been proposing to EU and to the USAID and what we've been actually doing in practice, and it may be because we're people with a mental health background, but we typically will have sessions where there is an explicit wish for people to talk about what their own internal experience is and the diverse backgrounds that they come from. And I must say the meeting that we had in Jerusalem earlier this week, we went on for an hour and a half in that effort, led by two wonderful psychotherapists, but we could easily have gone on for at least a half a day or longer. But I think recognizing the diversity within each of the communities is critically important, and what's wonderful about these educational opportunities is that it brings people together. But learning knowledge and being focused on what the needs of the disadvantaged or the people at risk are is just one step. Recognizing in the other the same values that you have for yourself and your own community, for your family, for your children, I think is a critical step. And the way our brains are built, we see the other in a different way until we can actually encounter them as real people with the same background, interest, and goals that we have for our own families.
The teachings of Paulo Freire's is critical pedagogy, and the notion that listening precedes dialogue, precedes action, and too often we want to rush in, get the roadmap to fix it. as opposed to going through a whole phase of respectful listening, and this could go on for quite a period of time. That will then set the stage for a different type of dialogue leading toward a shared understanding of issues, a shared agenda, and moving forward.
Well, what can we do? What can we do? We are not regularly going to the Middle East. We're not doing this. We're not doing that. And I think some of the comments that were made earlier in terms of some of the clubs that exist, and I guess with the opportunities that we have now using the Internet as we're doing this evening, it strikes me that one of the things that really could sort of move things forward would be the kind of multilateral dialogues that could take place between students in different universities across the region, where the initiative really is being taken by the younger members of the community to try and find out, well, what are the issues? How can we work together? What's your perspective on this, etc., and not leave it to those of us that are, as Harvey said, with the gray beard.